I've had a lot of end-of-life care cases lately. One of the more recent ones got me thinking. I get a call in the morning, right? And I go out. It's a death call. And I get there, and the patient had vomited all over themselves. And it didn't take me long to realize that they had aspirated or choked or drowned on their own vomit. And as I was prepping them, more came out. There was a lot in their lungs, and it proceeded to come out as you prep the body back and forth. Change the brief, change the clothes. There was a lot to change. And it was just horrific. It was just one of those terrible, horrific ways that a person could die. And it was in the morning, and there was no way that, there wasn't a 24-hour watch order on the patient, so there's no way to know. But I just you're prepared for this sort of thing, but not something like that. So the family didn't know. So of course I did the right thing. I told the family that the patient died peacefully and comfortably in the night of natural causes, whatever that means. This patient's natural cause was drowning in their own vomit. As they vomited, they kept vomiting, and their lungs would fill up, and they were unable to breathe, and so they would cough and gag and vomit more, and it would continue to fill up because they were at such an angle and they were unable to turn their head. Those instinctive things that the body usually does to prevent this weren't prevented. And the end result is a horrific, terrifying, Hollywood-esque event. And of course that I don't tell the family this. Of course everybody else thinks that it was peaceful. Why would you tell the family that, right? Why would you share them this kind of a detail? Why couldn't we have been able to handle that on his own terms, their own terms, her own terms? Maybe their spouse passed away a few months earlier and they wanted to be with him, and they were close enough that it would warrant the ability to shorten that and make it a lot more dignified. But instead, we have to allow people to suffocate on their own vomit. That's the kind of chance we give, and we're dying on the table when your lungs are your heart's getting pressed on and your ribs are cracking and somebody's performing CPR on you to save your life, but you're ready to die and you end up dying anyways, but in a lot of pain, excruciating pain, and it's a terrible experience. I've known people that have gone through CPR where they were still alive and going through CPR and feeling every bit of it, feeling their ribs crack as they go through. And I can't imagine this patient being unconscious as they were choking on their own vomit. I'm sure they woke up and felt the constriction of the lungs, trying to get whatever was in them out, and trying to cough but having no air to cough and nobody to cry out to because there's no air in your lungs to cry out. You're completely focused on what's happening to you, so there's no way that you're able to even push a button for help, and you might even be too weak to push it. So what happens is that you are wide-eyed and you're choking on your own vomit as you're suffocating and everything's closing in on you. Not quickly, like in a car accident, but it comes on slowly, and then the darkness comes over you, and then you pass out because of lack of oxygen. And who knows after that? If you go through the pain of your brain dying or not. When things die or don't have oxygen, they squirm a lot before they die, like a flame flickering before it dies, trying everything it can to stay alive. And I can imagine your brain doing the same thing, doing everything it can to stay alive. Unless there's something wrong with your brain. In which case, we talk about depression, and we talk about loneliness, isolation, and suicide, where you get the brilliant idea that suicide is an option. You go from indecisive to very decisive. Your whole mannerism changes. So if you know somebody who's depressed, that's actually a good thing. If you know somebody who's depressed and gets happy, that's a problem. That's where we're getting someone who has a plan, who's about to do something dramatic, try to end their life. And there really isn't a squirm before the death. It's like they're squirming to die, and they're ready to, and they're doing everything to make that happen. And so, I don't know. I wish we had more choice at that age. I bet this patient, had they been given the choice for hospice, that they would have chosen a different route to go out than choking on their own vomit. I'm sure their family will be forever at peace that they didn't suffer, but for that actual person, they had to do some suffering at the end, which was unpreventable. There was no way we could have stopped that. We give meds for nausea to prevent this, but sometimes in the middle of the night, it wears off. It's just not enough. You become nauseous, nobody's around, nobody's checking on you, you're in a home, you're by yourself, you're lonely, you're isolated, and next thing you know, you're drowning. And, I don't know. It was horrific. It was so sad. It made me think about my life and about how I would want to go out, and it wasn't that way, right? Like, it made me more want to go out on my own terms. Not now, per se. I've got my boys that are a huge strength for me. But what happens when that goes away? When they have their own families, when I'm by myself in my old age? I think after so much depression, or maybe I'll be used to it by then, I don't know. I don't think you ever get completely used to it, being isolated, being by yourself. But I think at one point, I might very well come to the conclusion that I want to go out on my own terms and not on what I ate during supper time, right? That sounds terrible. I don't want the last picture of me being covered in vomit and the coroner draining, all of my stomach contents out of my damaged lungs, destroyed lungs because I just threw up in them, Just, sounds like such a horrific way to die. Especially someone who's claustrophobic, who has a fear of drowning, who has a fear of losing oxygen and not being able to breathe, who feels anxiety and feels bouts of being unable to breathe often. It's not a pleasant feeling. It's a terrible feeling. It's painful, it's scary, it's anxiety-inducing, it's just frightful. I feel like we should give ourselves a future where we have choice until the very end. And we can make those choices now instead of when it's too late.